we're going to talk about ringworm. Are you ready?
Yeah. Bring it on.
Yeah, so I'm going to make this, I have a handout for later because I think that we should just have a discussion because I want to cover everybody's questions and thoughts and concerns and things you might have in the back of your mind that you think about. And we can just like hash it out because it has changed a bit back in the day, especially in what I would say the 80s. Ringworm in a cattery was like a death sentence sometimes, and it probably was due to the inability to be able to manage cats safely with oral medication. That's much more effective. There wasn't any oral medication that really, there was something called griseofulvicin. If anybody has been in the cat world for a long time, and it was hard to treat cats orally because it was brutal on their liver and on their, and so people would wring their hands, and in a cattery situation or a rescue situation or a hoarding situation, it became a big, but we have medications that are very effective now, so it's calmed a lot of that part down. But we still have to have a concern. And what's the big concern about ringworm? First of all, who can tell me what ringworm is? Is it a worm?
It's a fungus.
It's a fungus.
Ring nor worm, it's a fungus.
Yes. And what is the most common people fungus that's a ringworm?
Ringworm.
Oh, athlete's foot?
Athlete's foot. So athlete's foot and
Toenail
jockish and toenail fungus, all three. They're the most common in people. Is ringworm, I shouldn't put it this way, but it's easy. Is ringworm the most common skin infection in cats? If you see a skin lesion in a cat, is ringworm your #1 possibility?
Yes, but that's probably wrong.
Yeah. Well, in your situation, the first thing you're thinking as a cat caregiver is, oh my God, it's ringworm.
Yeah.
But it is actually the rarest of all of the skin lesions you would see on a cat. The most common, even in Arizona, is allergic dermatitis. So bacterial, because the cat is itchy, like I'm doing right now because my allergies are so bad. In people, we have a lot of allergic dermatitis, but we don't usually get the lesions that animals do because we don't self-mutilate as much. We stop before we hit blood. Most of the time. I'm bad with my ears. My ears get really red because I'll be going like this because I'm very itchy. And so allergic dermatitis, #1. Which turns into bacterial dermatitis is #1. And in Arizona, #2 would probably be flea bite dermatitis, which is crazy. We shouldn't have fleas here. I lived in humid East Coast, and we had fleas was everything. Yeah. But that's still flea bite dermatitis and mosquitoes. Mosquito allergy is huge. So all the lesions we see, and then of course abscesses and things like that, all the skin lesions we see are usually that. Less likely to be ringworm. And in Arizona, why would ringworm not be as common? Yeah, because it's dry, except in homes. So ringworm loves, fungus is love. Think about athlete's foot again. They love damp, dark, warm. So we have the warm, and a lot of places we have the dark. So the damp depends upon where you are, and so that's what ringworm loves, for sure. So what's the big problem with ringworm in cats? Like, why do we worry about it so much?
Contagious.
Yeah, so it is a zoonotic disease, which there are a lot of zoonotic diseases. From one of the most common animals to give people ringworm, if you've ever been a country girl in your past life, sheep, lambs. So there's actually a syndrome where they'll call it like the 4-H ringworm, like the kids that are raising their sheep and goats. Ringworm all the time, all over the kids. So it's a zoonotic disease. Does it worry us in humans? Is it a scary disease in humans?
I don't think it is.
It's
It's contagious. But
Yeah, so, and what's the other thing that can happen between, we're just gonna talk about cats, because dogs get ringworm too, but what's the scariest thing or the other interesting thing about humans and cats and ringworm?
It's not transferable from cats to humans and humans to cats.
It is.
Oh, yeah.
It can go both ways. So you can give it back to the cat. So you have to realize that if you have hair follicles that still have ringworm on them, not just the scabs would ends up, but if you have, which that's where the spores are. So fungus builds these little spores, which I think of it as like little encapsulated pollen. In my mind, that's kind of how I visualize it. If you look under a microscope, the hair, instead of looking like a normal pretty hair shaft, it's like all thick and yucky. And I kind of, those spores are what's the infectious part.
Well, what I mean to say is that humans don't get ringworm from cats.
Oh, yeah.
They can
Oh, yes, they
Yeah,
do.
they do.
Yes, they
It's
do.
both ways,
I
and
did
that's
not
why
know
it's
that.
called a zoonotic, is that it is a disease that can be transmitted from pets to people and back again. Now, some diseases can't go back again, but ringworm does. So if we have a cat here with ringworm, what precautions can we take for us?
Send them to medical.
Well, don't touch it.
Yeah, I got ringworm
Gown
in
up.
medical.
Yeah.
There was a cat that we had, it was in a regular cage, you didn't know it had ringworm,
Right,
and I got it.
right.
So,
did too.
yeah,
So
Yeah.
cleaning your hands,
washing.
washing really well after you handle a cat that has a, even if we don't know if it's ringworm,
Right.
but it has a skin, but you're doing really well. And we've come a long way in the past few months, and maybe I had a little bit to do with it from room to room. So the sanitizing solutions and the feet and everything, it's just smart practice, okay? People who get ringworm, 4 days, 5 days of a topical, you're gonna be fine. It'll go away. What people do we worry about with ringworm?
Kids and the elderly.
Very old, immune suppressed, so
Very
somebody
young.
who's undergoing chemotherapy or immunotherapy or has been really ill has a bigger chance of getting ringworm. Happens a lot in nursing home situations. They get ringworm all the time because they transmit it from each other. There's no cat there, but somebody brought it in, and and it happens that way. Maybe somebody had a cat at home and came to visit their grandmother, and the grandmother got it and they gave it to the whole neighborhood. So it happens a lot.
How does it transfer from person to person? Can a spore live? So if we shed, right? Cats shed.
Yeah.
So if a hair's here and has spores on it, and I'm wiping the table, and so it's on my hand, that's how
Yes.
it could transmit.
So that's
too?
what the problem is, and so yeah, we're gonna move to that, but
Okay.
perfect situation. So it's transmitted direct contact, but really contact with the spores. So think about all the cat hair that's everywhere. The spores can live in the environment, and they live for a while, especially if it's dark, damp, and hot, right? Those are the three things, so in the corners and everything. And that goes to how we're gonna take care of it here, how we think about in a situation like this. So far, I kind of told you that it's not that bad of a disease. The reason we're worried about it is because it's transmitted. Just like when you get athlete's foot, it's because you didn't wear flip-flops when you went to the swimming, up at McCormick Ranch or whatever, and you walked and you took a shower, you just walked through the bathroom, and you got it from somebody else because the spores are living there in the wet, hot environment. So, the reason that ringworm becomes such a problem in a situation like this, or in a cattery, or in a colony where maybe there's a home where they have a lot of cats, is because of the environment, because of the layers of dust, which is basically hair and spores sitting there. So you can take concentrated bleach solution, but if you still have spores, you're not going to do anything. So the key to keeping the environment clean is vacuum, dust, Swiffer first, and then use a solution. What kills ringworm in the solution?
Rescue.
Yeah, exactly. So everything kills ringworm. Rescue, awesome, or a cell.
Just bleach?
Just bleach.
soap.
You don't even need to use. You don't even need to use like a concentrated 1 to 10 bleach. You can. Studies have shown 1 to 100 works. Most people say 1 to 32. I don't know if you guys use bleach. Do you use bleach?
No, I think it in the
But
long
even
Yeah.
in Fearless Kitty, if we use bleach, most people have they'll have a protocol, and the protocol say 1 to 32 or 1 to, but you don't need it really concentrated with bleach. But what else? If you're buying something in the store, you're looking at the label, like Lysol. You're looking at the label. What does the label have to say to know that it kills ringworm?
Antifungal.
Yeah, that it kills athlete's foot. So it'll usually say effective against trichophyton. And even if you spray the air, it'll say kills trichophyton, which is the athlete's foot, in 10 minutes. If you're spraying like cat stands or something like that. So you can be pretty confident that what we're using, Clorox wipes, all of it, you can be pretty confident that everything is killing ringworm. So the biggest concern would be if there's a big pile of hair, it's going to be much harder. So get the hair away first. And here in Arizona, it's better than other places because a lot of us don't have a lot of carpeting. So I'm thinking about homes because you may be talking to fosters, or you may be talking to people who recently adopted and then the cat has a lesion and they're panicking at home. If they have carpeting, they need to vacuum every day and then wipe surfaces with something that's going to kill a fungus, and they will be fine, but they need to take care of that. What else should we do here with all of these kitties? What else do we have in all the rooms that we should be concerned about?
Bedding.
Yeah, bedding. So ringworm will die in the washing machine when we do the cycles, that hot cycle, for at least 15 minutes. So it will die. So we're fine. How long does it take to show up? Does anybody know? Like on your arm with you, how long do you think it took?
I'm gonna say I think it was 2 days.
Yeah. So that in people, it tends to show up pretty quickly
Right.
because
And it was an actual
a circle. Yeah. It tends to show up quickly because
Yeah.
they don't have a lot of hair. If you have, and it oftentimes will show up faster. I said the immune compromised, the old or the very young. Also, if you have a wound or cut or scratch, because your skin is really good barrier against disease, no matter what. We can abuse our skins well, but if we have lesions, like scratches or whatever, that's a more likely spot for ringworm to get. Also, what's my favorite story as a young veterinarian who is probably 30 years old, when I went into the exam room, what's another big place that humans may get it and they ask you, what do you think this is, Doc?
Yeah.
The bra line.
Oh.
Yeah, so a lot of times like the sweaty, like you're cuddling your kitty and yeah, so it's very common for people to say, I have these lesions and I don't know what they are, but it's wet and hot and dark, wonderful dark.
That's why I think bras should be outlawed.
Outlawed.
Yeah.
So ringworm actually has an incubation period from 4 to 14 days. So that's why if you'll see that the medical will be doing a culture to look for ringworm, we have to wait a full 14 days before we decide that the culture is negative. So you may be wondering that we have a cat with a lesion, we take it to medical, we're treating it, and then you're like, why is this cat coming back? It's been weeks and weeks, and the cat looks normal, all the hair's grown back, but they're still not coming back because we want to definitively know that it's gone, and it can be it can be short, but it can also be long. There are a couple funguses that are ringworm common in cats. One is called Microsporum and the other one is Trichophyton. You don't have to remember that. But the interesting thing is, has anybody seen a quick and dirty test that we may have done to be able to tell if a cat has ringworm?
Just that light.
Yeah, so
The-
there's a
the
UV
black
light,
light.
the black light, it's called a woods lamp,
Right.
and it's less than 50%, somewhere between 40 and close to 50. I always say less than 50% will fluoresce, and they fluoresce like apple green when it is. But there's a lot of things that fluoresce. Have you guys used black lamps for pee, right? And you go around and
Yeah.
so there's a lot of things that fluoresce, and it's interesting when you have a cat with a lesion that you're like, is this ringworm or not? The crusts, the scale will be colored. So we have to really look at that and take the results as, no, this isn't ringworm, I'm not sure. But if it's the hair shafts, which is why sometimes we'll use magnification, if it's the hair and you can see that it's the hair and it's bright green, that's a pretty definitive test of ringworm. So we would treat immediately and keep them away from other cats. And why do we keep them, why do we move them and keep them away?
Because it's
Right, and it's also easier to clean. If all that ringworm hair and dander and spores are in isolation, that's really good. You may notice though that we have an isolation area, we may have some decisions to make, because if we have cats with respiratory disease who are immune compromised, and then we put ringworm in the same isolation, that's not really good. So we would probably not do that. We would make a decision. But you may see us during ringworm season put cats in isolation because they all have ringworm, and then we decide what to do with respiratory, or vice versa. Respiratory would go in isolation and we decide what to do with the ringworm. But we want to confine to cats that they already all have it, or that they've been around. Like if it's a litter that only one is showing symptoms, we may, like little kittens, we may treat them all and treat lesions, because sometimes it won't show up at the same time for everybody.
Oh yeah.
But they've been together, and so we just treat them all. Yes.
Quick question. So I was thinking about this scenario where we have kitties in ISO for any other non-ringworm reason,
Right.
and then we discover ringworm. Would it be, and you don't want that mix in ISO, so could we, or would it be appropriate to dedicate a room in here and say the turquoise room, for example, is the new ringworm room?
Yeah, and that's
And
We've done that in the past.
and that's an excellent thing to do. Last time we had some ringworm kitties, they were all in isolation because we didn't have any other problem at the time. But I agree, if we have a URI rash where they have to be isolated and ringworm, we would make a decision to make one of the rooms a ringworm room. And keep the URI in. That would be our priority, to have URI, because that's contagious much more than ringworm. You know, ringworm, as long as you guys are wiping down and mopping the room every day and cleaning the room, and you're going from room to room and you're doing the ringworm room last, it's a much less chance of contagion than the respiratory. So they would have priority to be in isolation.
I have about 2 more questions.
Oh, I'm glad, that's what we're here for.
So in the in any of the scenario, so we normally gown up with the full thing, and we have hair bonnets, and is that necessary still? I mean, should we be doing that, or
I
is
think
that
the protocol
overkill, or
is a
what?
good protocol. I do,
Mm-hmm.
but is it really necessary? No, but I think that because it's a public area where the public comes, and we can pass the red face test and say that we've done the highest level of biosecurity, basically, and for you too. But it would be relatively unlikely the biggest thing that I like that you do that is especially your foot booties,
Mhm.
and
Yeah,
I think that is the most. And if you're cuddling cats, that's really, you know, and you'd rather be wearing a gown than
Yeah.
cuddling cats,
Yeah.
and they want to be touched.
Yeah.
So I feel like that it seems like it's way overkill for something that I just told you is not that big a deal.
Yeah.
But
But I don't
But-
think
But
it
that
is.
one time.
right,
But see, I don't
is
think
all
it
it
is,
takes.
because when you are handling these cats, you're medicating them.
and you're hugging
And
them
you're
and
holding them,
kissing
because you're not, you can't just
Yeah.
like this
Right,
and medicate.
exactly.
Sometimes you have to pick them up and hold them
Exactly.
here. So I don't want it on my clothes, because
Nope.
I don't want to take it even
Take it
just.
home.
Right, and what's nice is we opened up the back so we could leave right after, but
Yes.
if we ever have the respiratory issue, and I worked at a shelter where it just went rampant,
right,
the respiratory, because they didn't have enough places.
right.
So it's nice to be able to leave after. So
Right.
if you're doing the one room here, I still wanna leave, that's why I'm gonna gown up and
Right,
not
and you
take it
can-
on my clothes.
Right, and you can have the gowns right in
Right.
the room and the whole
Exactly.
thing. And I feel like, so people ask that question a lot, like, what do I do at home? So say you're a foster and you have your litter at home and you have ringworm and we're like, keep them there, you know. And at home, you're gonna set up your protocol for how you are and be really comfortable with that. But I feel like here, because it's a public facility and because we are caretakers of public trust, that we do the highest level, and we can pass the red face test and say, nope, we did it, you know,
Yeah, like
exactly
Exactly.
like that.
Just one more, I think this is it for me, but, so what about the sulfur dips?
Yes, so this is a great question, because we're gonna talk about treating them, because I
Yeah.
said that back in the day, if you guys knew, sometimes catteries would just euthanize all their cats.
Oh, God.
Yep. Can you imagine? For ringworm. But it goes back, and I'll tell you why. What are the cats that have the most difficult time with ringworm? We said the young, the old, and the immunosuppressed, but is there a particular other kind of cat that might have a difficult time?
Ferals.
No? Ferals have really good immune systems usually.
I don't know, the cats
but
that
you can, long hair, did someone say long hair cats? Yeah, so long hair cats, because think about getting to, because those spores are on the hair, but they like right at the follicle, the base. That's their happy spot. They're not on the tips like lice. Lice are so easy to treat because they're on the tips, and no big deal. But they're kind of right at the bottom, right? So I recommend with cats, and we've done it, and Melinda's done it, that long-haired cats that we have here that have a lesion, we just do a line cut. Just because it'll be so much easier, because you'll treat them, they'll be done faster. Yes, ma'am.
Melinda also really likes keeping her skin, so Melinda likes that we can afford intrafungal and do.
Well, we haven't gotten there yet. We haven't gotten
She was
there yet.
asking about
Yeah,
Lyme sulfate.
right, I know,
I'm
we
just,
haven't
you know,
gotten there yet. So
I'm just pointing in the direction
the other breed of cats that has a higher representation of ringworm, and they can't decide why, are Persians. So is it the Persians? They're doing a bunch of studies with Persians and Himalayans, and they have found a genetic defect. So they believe, and they're actually the only breed that develops skin nodular lesions. They look like tumors, skin tumors, and it's caused by ringworm. And it's the only breed, and Himalayans too, because they have Persian in the back, but Persians. So Persian breeders, if one ever comes in here to adopt one, oh my gosh, they will be like hysterical about ringworm. So it's just one of those things. So back to the treatment, Lyme sulfur dip. Anybody do it? Have you done it? Have you done it?
I have only seen it done.
Yeah, so Lyme sulfur kills ringworm, awesome. It's great. But you have to penetrate the dip to the skin, so they have to kind of soak it in, and it smells so bad.
Oh
my
God.
But
Oh,
it's
sulfur, yeah.
but it's really good though.
Oh.
Like it's really good for bacterial dermatitis too, and that's why it was so popular for decades. I mean, it was like #1 for derm diseases, not just ringworm, in all species of animals, large animal, small animal. Lyme sulfur is awesome. And a lot of the old timers, and I guess I'm considering to be one now, we're like, lime sulfur is awesome, but it stinks and it's no fun. Once they decided that, and did enough studies, that chlorhexidine is a killer of ringworm, we decided that chlorhexidine was just as sufficient as lime sulfur. So using chlorhexidine, and they have shampoos that have chlorhexidine combined with miconazole, which is another topical antifungal that people may know because of vaginal yeast infections. Again, those work really well together. So our protocol recommendation is usually shampoo everybody at least once a week, twice a week if they're sweet. Because
If they let you.
if they let you. And there's also neat things like we have the chlorhexidine mousse, which is great. And there's a spray. I like the mousse because they're not afraid of the spray, and you can massage it in. And then the biggest advancement is first there was griseofolacin, and then ketoconazole, which cats really can't take, it's toxic. Then itraconazole, which is what cats take, and they take it really well. It's very safe and it's very effective. And the nice thing about fungal medications is we don't tend to have resistance like we do with antibiotics. So the fungus is kind of not a really bright organism compared to a bacteria. Bacteria are smarter, and they have the ability to modify and change and decide that penicillin doesn't work for them anymore. But fungus is fungus, and luckily it doesn't modify. You can go back and use lime sulfur and it still works. It's not that it doesn't work, it's just that it's gross and you have better options. So itraconazole is very effective. It's
Is that topical then, or is
it's
that an oral?
oral.
Okay.
Yeah, and
So you
it,
have to pill the cat still.
well, it's a liquid,
Oh, okay.
so it's not so bad. And many cats that we have here in rescue, luckily, may only have we might see that we're not even putting them on the oral, we're just doing them topical because they have one lesion, and we caught it really early, and we've been able, because the way it spreads is spore. So a cat's gonna get a generalized everywhere if we missed it, and it was there long enough, or they're really immunosuppressed or something, because if it's localized in one area, the only way it can spread is more contact with spores.
So cats like to groom themselves.
Mhm.
How does that interact?
You can
with
actually see it
ringworm?
travel.
Yeah.
They'll get it. Mine actually commonly got the first lesions near their ears.
Yeah.
And then I'd see them on,
On
their
their
paws,
hands.
and
So
then
it's
I'd
there.
see them further there.
And
You
that's
can
a
s-
great, that's a
yeah.
very
See
great
it
point and a
travel.
great question, like where do you see the lesions? And it's very typical because their tongue is transmitted.
And that's why the intrafungal is good too, because it's systemic, so their whole body is getting treated with
Yeah.
every treatment instead of just that one spot. So even if they are licking and cleaning their body, their whole body, it's a systemic treatment. So that's definitely an advantage of it.
And what do we do with the environment? We talked about the vacuuming, we talked about the,
Well, one is.
yeah, oh yeah,
Lots of times when I'm cleaning rooms, the broom is full of hair.
yeah.
Would it be worthwhile to take the Clorox and clean the broom
Yeah, once
after we
once,
finish?
if you can get all the hair out of it, then,
It's usually just clumped on the
yeah.
bottom.
What I would do, you could do Clorox wipe, or what I would do is after I get all the hair off, I'd spray it with like a spray, like Lysol
Like
or
Rescue.
something.
Rescue.
Rescue even, rescue would be
We got the
great.
rescue in there.
Yeah, if you have, then I would just, as you're leaving the rooms, get the hair off of it and spray it. And that's kind of a good routine, like I would think that to get into, because that broom stays in the room, so you're
Right.
doing a great job. Every room has their own stuff. But if there's still spores on there, you're just spreading it around the next time you vacuum.
And
I
that's
usually
important
clean
too.
it
You have to
off,
remember
but
all the grooming tools.
Spray.
Yeah, all
Brushes,
the grooming tools.
combs, everything have to be
Even
disinfected.
the dustpan.
Yeah.
Right.
They should be anyway.
Yeah, and they talk about, so the recommendation, like if you go to the CDC website and you read what to do about ringworm in your home, the first thing they'll say is wash all your bedding every day, vacuum every day, wipe down your walls, and all your cat toys and everything, throw them out. And I think that's a little bit of overkill, again, but the CDC is probably the way we are with our PPE, saying, well, you know, I just have to say this just in case they have a kid with a disease that is really immunosuppressive. But I think that if you spray, if you use the rescue, if you're wiping everything down, if you're cleaning, really, because you guys are so good at cleaning, you're like, it really is less likely that we would need to throw everything away. But that brings me to the point that I started with: how do we know that the facility is okay?
No lesions on any cat.
Yeah,
that's true.
I was gonna say, no one has ringworm.
Cats are sentinel.
Pay attention to the cats.
When we have an outbreak, and we haven't, no, should I not? We haven't really had one horribly. We've had a couple isolated incidents, but we will. So I talked about the wood lamp, right? If the wood lamp doesn't light up, I said if it lights up, that's pretty much ringworm. If it doesn't light up, but we still think it's ringworm, what do we do? Well, we treat it like ringworm, but we also do a culture.
Right.
So we take the hair, pulling the hair out and getting that little ball at the end, getting the follicle, and we stick it on a plate. And it's really cool because the gel on the plate has a color change if it is microsporidium or trichophyton. So it turns red, and it's 4 to 14 days. So we have to look at it every day because there are a lot of things that turn this plate bad, like other things in the environment, like fungus from soil and things like that. So ringworm doesn't come from soil. It's not that. So but there's other things floating around everywhere that will cause those plates to turn. So we have to check them every day and make sure something else isn't growing. But when it does come up positive, we know it and we can confirm it. Still, if it looks like ringworm, we'll treat it. But like I said, a lot of the treatments that we're doing, the chlorhexidine, not the itraconazole, because that's only for fungus, but we're doing a lot of things that also treat the #1 cat lesion thing, which is bacterial. So when we use the topicals and we're doing chlorhexidine bathing, especially in the moose, we're also treating bacterial dermatitis, which is our #1 cause of these lesions. So they may get better, and we may be like, I don't think that was ringworm, or maybe it was, or we may never know, but it's better now. If we have a bunch of ringworm, we can also use those plates, the culture plates, to test the environment. So, for example, Melinda will say, we had a ringworm cat in the green room, and we cleaned it all out, and we got rid of all the other cats. Everybody's been tested, everybody's been good, and we've treated lesions, everything's done. I just want to make sure that environment's good for everybody to go back in there. So she'll take a Swiffer, and she'll Swiffer the whole place, and then she'll take that and culture the hair and dust that's on the Swiffer to make sure that there's no ringworm. So then we wait 14 days and then we see that place is clear. So we're working really hard to make sure that we can say to the public and to our volunteers and to everybody that we're doing our best to make sure that, because how long can the spores live in the environment? A long time. There's no specifics on how long, but months. Yeah. So that's why the vacuuming and cleaning is the most important. And dry and sunlight is great too.
So if a cat has gotten ringworm, are they more susceptible to get it again?
No, but, not necessarily, because they have to be in contact with it. So first of all, it depends upon their risk. So have they been around another cat with ringworm? It also, at the time, they may have been immune suppressed, they may have had a URI, they may have had something that made them more susceptible, because they're probably in contact with spores, and you guys are too, more often than you think. And you don't get it because you're healthy. Your body can fight it off, and your skin is healthy, and you don't have a wound and the whole thing. So it doesn't mean that they're more susceptible. Excuse me.
You can get your water.
My allergies are so bad today. Thank you.
My question is about prophylactic treatment. So if it's a ringworm,
Yes.
rather than waiting 14 days,
Yes.
do you recommend that we just go ahead and start treating?
And
it?
we will. If there's a lesion, they're being treated. Also, if we have cats in the same area of a cat that has a suspicious lesion, but they don't have any, we will still use chlorhexidine bathing, and we might not put them on itraconazole, but we will prophylactically, proactively, and the topical treatment is really a decontamination more so than a treatment. Even though it does, like I said, treat bacterial and fungal skin infections, it's really decontaminating the area for the most part.
And what's the estimate? How much is it costing to treat? I'm just curious.
The itraconazole used to be very expensive. Now it's generic, so it's not very expensive. Do you know?
I cannot get a generic, I still pay $60 a bottle.
Wow, really?
Yeah, it lasts a long time, but
Yeah.
yeah,
Okay.
yeah, that's why, like, if we use the, like on cats that we don't see active lesions, we'll use the mousse.
Sure.
And we have
You have to buy
bottles of that.
Sporanox?
Huh?
You have to buy the Sporanox brand? The
It says intrafungal, yeah, right on,
itraconazole.
I
No,
get it
so
from-
that's a generic. $60 bottle, but the bottle lasts a long time.
It
right?
does.
Yeah. So it used to be like the
Hundreds of dollars.
Sporanox was the brand name,
Oh, no, I
and
don't
it
know
was
that.
like $600.
Oh my lord.
And like it was a big deal, but now it's cheap. It's
But you only use that for confirmed cases, right?
right.
Well,
So,
no,
right.
she just.
Well, and
moves.
so the topical. Well, no,
The
all of the topicals are cheap.
Yeah.
They're really
So
cheap.
you can get a big bottle of the shampoo. I keep it on hand because I have kids and cats all the time.
Right.
Under $25.
Yeah. And the mousses, they're all
And the mousse is
very
really cheap,
inexpensive.
yeah.
And then the topical lesions, sometimes we'll use just over the counter myconazole.
Yes, I know.
You'll see all the, you're like, why is there vaginal cream here?
Yes.
But that's why. Because it's a really good killer.
Antifungal, sure.
It works really, really well.
And she's the one who turned us on to the mousse, and
Yeah.
I love that, you get a
Yeah.
handful of it, just rub it all over them, even if they don't have a lesion, you're still treating any, you're still decontaminating the cat.
Right.
Absolutely.
Right.
I have one
It does smell good,
questions.
yeah, that mousse is nice.
It's
yeah.
about protocol.
Yeah.
When you do have litter, say, with ringworm. So Sandy, I shouldn't have mentioned her name, would feel sorry for them, so she'd let them out of their cages in isolation so they could all run around together with, and she would say, well, you know, they've all got it, so I'm just gonna, and when they're all done, we'll clean out the whole room. Isn't it better?
I wouldn't do that.
Leave them
I
in the
would-
cages,
I would-
correct?
If it's a litter, and I think Melinda feels the same way, if it's a litter, the litter can stay together in an area or a bigger
But it
cage or something, but we shouldn't contaminate the environment unless we have a room that we have a big outbreak and we have to dedicate green or something. You know, that's our ringworm room. And we would probably, if I were king, which Melinda would is, I'd probably pick pink because there's no windows, there's no, like, so it's the easiest to decontaminate when it's all over because you don't have the outside windows and you, like, that's a little harder with all the nooks and crannies of windowsills and stuff.
So I'm just gonna add two thoughts to the idea of why we let them not in too small of a kennel. There's stress is a #1 contributor to a cat getting sick.
Sure.
The length of stay in a shelter is actually the #1 contributor to a cat getting sick in a shelter. So #1, my preference is always that anyone who would be willing would take a foster litter home.
Right.
So far, I'm the only dum-dum that does that. But that's why we didn't have an outbreak last year. As soon as I saw one with a ringworm, it went to my house.
and that's-
You guys didn't even see it.
Well, and that's why I say that if somebody calls who isn't fostering and they're like, oh, my cat has lesion, I'm like, cool.
Say,
keep it,
yeah, you keep
you know,
going, yeah.
and when you're discussing with people or your fosters or you're sitting and thinking about, should I foster this litter? At home it is much easier. Like you can dedicate a room, you can really do really good protection protocol at home, more so than here, with less of a chance of transmitting it.
Right, and then the cats are not stressed, so they're not getting sicknesses in other ways. They're happy. They don't even know that they have ringworm. It doesn't affect them at all. And my own cat's Oreo one time got a lesion that big, but she's a strong, healthy cat. It was gone. I didn't have to treat it. She's gone. My daughter got 2 spots, gone, and that's from all of the foster litters that I've taken home that had ringworm. That is the only issue that any of us have ever had with it, where those like 3 little tiny spots that cleared up Taylor's cleared up in less than a week, which I didn't even think was possible. So if they're not stressed and their immune systems can recover so much faster, they can also fight it off a lot faster. Has been my experience with them at my house. I know it's unfair to ask anybody to do that who doesn't trust that idea. I get that, but that is why then, if we can't find a home for them, if we can find a space for them where they're not stuck in a kennel, their stress is lower, they're going to recover faster, they're going to be less susceptible to getting other immunocompromised things like a URI or something else because they're not stressed. So that's why Sandy made that decision. When it's a hard to catch litter, I don't agree with it because they've got to be treated right. So that was where we would kind of go back and forth. If it's a hard to catch litter,
Or they're all black.
absolutely don't put them.
They're all black.
Yeah.
You're trying to medicate them.
Right. Which one did I do?
I medicate
Yeah.
them, stick them in a cage, grab the next one. But they were, sometimes you're under the cage trying to catch them.
Yeah.
That's
So
why I
those
didn't
kinds
like
should
it.
not be in the
It's
room.
Well,
hard
I
in
trust your
medical.
judgment.
Yeah.
Whatever you
Yeah.
decide. we'll
Yeah,
do.
but yeah, when they're hard to catch or when they're shy, those should not be loose in that room. It's
It's too hard. You're going to medicate them.
Well,
And then they're gonna
medical
say
is
shy and
not-
mighty.
is not the easiest room to clean, and
Yes.
because and there's a lot of stuff in there.
Kennels
Now the
are-
isolation that we now have is easier to clean, and so you might even say, all right, well, we could do it in isolation, let them out, because
that's where she would
That's what she'd let them out there.
right, but
And we had like baskets with
but
bedding
it
in
looked
and all
different.
this stuff.
It wasn't the same.
And we had a lot of stuff on the floor,
Yeah,
and,
we
the little baskets, the woven baskets, remember that, with the blanket in it?
yeah, so it's hard, but
It was really hard to catch it.
sometimes I think in situations like that, because Melinda brought up a really good point, because we didn't talk about how long does it take to get rid of. We treat for 14 days because we know that that's the protocol. Really, in the majority of cases, we will see, especially the skin lesions, resolve within 4 days. And in people, 2 days. 2 days in to get it. 2 days you want, so it's very fast. But in situations where we're having trouble cleaning the environment, or you're noticing, boy, these cats are not getting better. This is really strange. We have to look. Wow, I never even thought of this basket of towels that we haven't touched that like we haven't done anything with, because like I said, it's going to be transmitted by the spores that are in the back to the cat to itself, so it's going to be a self-propagating disease if you're not clean.
And that's also why the maze is in there, so that they now have a much bigger, if we only have like 2 that need, we have that maze, they can do the whole thing, so they can at least
So-
move a little more.
Will,
Right.
in the future, will medical be responsible for cleaning the isolation room before we leave? If you have,
So number one, I'll try to use the maze first, because I agree that cleaning the room is hard. If they are stressed and unhappy in the kennel, then I would consider moving them into the room. But then I treat with intrafungal, so it's hitting them systemically. So that idea of recatching it should be more limited. And then once they're out of the room, then Malia and I usually go in and tank sprayers. That's why there's a tank sprayer in there. We little rescue the entire, like all 4 walls, the floors, however high they may have gotten. Like that room just gets saturated in rescue, and that is absolutely not on you guys to have to do.
okay.
No way. So, but again, they'll only be out of the kennel if they're stressed in there. So, but that's why we make the big maze, so that they have more.
That's good.
Yes, ma'am.
The inner fungal medicine thing ingest the liquid stuff, does that beef up the immune system or does it just kill it within the immune system?
It just kills the fungus. It doesn't do anything to help support the immune system, which is a good point. What can we do to support their immune systems while they're fighting this disease? There are all kinds of immune support supplements, but the problem with cats is we don't want to shove, if they're not going to eat, if they're not going to, more stress with medicating if it's a cat that isn't happy, and we need to get the oral fungal medicine in. So I always say just a really cool environment, like a happy environment, cool, happy, and cool is nice too, because fungus hates cool. Stress-free, really good food is important. Nutrition is important. High protein, good food. So if it's a litter that came from somebody dumped them, they're already probably nutritionally lacking, and they have lesions. We're going to beef up their nutrition. We're going to do things. If sometimes we'll say, oh, these cats look like they could use more weight, so we'll work on that as well.
Is there an age limit as to what's considered too young to treat?
No.
Inner fungal?
No. Well, I mean, sometimes with litters that are still nursing, the mom, they'll all come in with it. We haven't had one of those. They're brutal if you do. We treat the mom and we treat the kittens topically. You know, we won't treat them with itraconazole until they're at least 4 weeks.
Gotcha.
So you'll give the mother the liquid medicine. Okay.
So they'll probably get some food.
Yeah, and then we treat them topically. Yeah.
Is there any protocol around, I don't work in medical, good thing. But do you also wanna have a mask on just because hairs float around in the environment, so do you wanna have a mask on?
You can't, it won't live in the digestive tract. It gets killed by the acid in the stomach. So, and it's not a respiratory fungus. There are other funguses that are respiratory funguses that people that are immunosuppressed can get, but Microsporidium is not, which is good. So we were just talking about this because there's some pictures online of cats with fungal infections of the respiratory tract, and that's Aspergillus. It's another fungus that is can be really, really problematic, especially in immune suppressed humans and animals. And it can look like cancer because it'll just eat away your bones and eat away your respiratory tract. So again, not the same fungus, which is good. There are a lot of bad funguses out there. The other big thing is we mentioned the toenail fungus, which is the same family as cat ringworm and jock itch and athlete's foot, but there's also toenail bed infection that's Aspergillus, other funguses that comes from soil, dirt fungus, like this.
Question?
Yes.
So do you recommend as our protocol when we're treating ringworm in isolation that we gown up, we put on booties, we put on the hairnet, and we put on the gloves?
Yep.
All of that?
Yep.
Okay, I just wanted to make sure.
Yep, I do. I do recommend that. I think that, like I said, it's probably overkill, but in this environment, if you had a cat at home and you didn't do it, I wouldn't be upset.
Right.
Like if you were fostering one at home, I wouldn't be upset. But in this environment, in this public environment, and it's the last thing you do before you leave.
Exactly.
Right.
If it doesn't live in the soil, where do cats get it? I know obviously from other cats or from a human, or where did it like start?
Good question.
A lot of animals,
Yeah.
hare get it, horses get it,
Yeah.
everything. So
It
it'll
has to come
skip.
from somewhere.
Yeah.
Well, it
it's
doesn't just appear.
Well, it's like where did roundworms come from?
Yeah.
You know, and where did So because there's
It's in the
so,
environment.
it's
It's
all
mostly just past.
past, yeah, and then because the spores can live off the host, so the host is the animal, which is cattle, sheep, goats.
Which it does need to continue its life cycle.
Yeah.
It can't live in the dirt and reproduce.
Right, it can't,
It
so it has to find a
host,
host, it has to find a host,
But
it
then
has
a
to
hair
find a
can
host.
drop off.
Yeah,
And with spores can live in the dirt for a long time.
yeah, they live there for a while, but they can't reproduce, so you don't have like,
They're just waiting.
a lot of people think that the issues with hoarding situations and catteries is that the ringworm, the fungus, is living in the house and growing and waiting. Kind of like, has anybody been watching that The Last of Us kind of movie? Have you been watching that on HBO where it gets a? If you haven't been watching it, watch it. It's really gross. But anyway, but this particular fungus, it just sits there and waits for the living, hot, sweaty animal to attract, like to roll around.
To touch it.
Yeah, to touch it, and then so it's not that a hoarding house is like a haven for. It'll like that it's it's just that you need to
Probably
clean
hasn't
it.
been cleaned
You
real
need
well.
to clean it, and that's the
The
big
light
issue.
doesn't get to it.
Yeah, yeah. So that's a really good thing to know that if we keep it clean, it's not gonna spread.
And normally we fight it off.
Oh yeah.
Sometimes
normally. You probably
may
touch
get
it
a
all the
lesion,
time.
You don't even realize it's there, and within 2 days it's gone because we're typically healthy. On community cats, if I see one outside that has it, I know it has other problems too, because they run into it with each other all the time.
Right. And there'll be a whole colony, and we'll see that all the time. If you've done any colony work where you'll go to an area where there's a lot of stray cats and you'll look at them and you'll be like, why doesn't everybody have a skin lesion? You know, why doesn't every coyote that walks down the street in Fountain Hills have scabies? You know, one does because he's immune suppressed, and everybody else is fine. And you know they're all talking to each other.
Yes, they do.
Yeah. Cool. So does everybody feel a little bit better about ringworm?
much more
I mean,
educated.
it's so scary, and I think that historically, like I said, because when I knew that we were going to talk about ringworm, I was like, why? What happened to make it so scary? And I think, like, if you guys start Googling and you look at the history of, like, it was horrendous what they would do. And I don't know if you said something to me recently that you heard that there was a euthanasia.
I don't know if I have not had a chance to verify it,
Okay.
so I can't.
But there's no reason. And now there's certainly some zoonotic diseases that are really a lot scarier. So, but I think that zoonosis, we should all be really educated about what can be transmitted and what can't. The protocols that we do for cleaning and washing and not touching our face and all this protects us against most everything. We just have to be smart about it, you know, and realize that there are animal and people things, transmissions that exist, but just being smart about it as well.
Well, don't you think part of the reason they euthanize, especially in these huge shelters like wherever the big ones, is because of the expense of it? You've got those cats in there and they don't, and space. They don't have room for them, and they don't have fosters that'll
And
take
not
them.
only expense the
Yeah.
time and
Right,
manpower it takes.
because if
I know
it
some
takes a
people
month
that-
for
yeah.
them to get going and they make their
Yeah.
money off of the adoptions.
Right.
I know some people that do rescue and they'll actually pull
Right.
from county shelters and municipal shelters. They'll pull purposely ringworm animals.
I'm
Because
trying to
it's
move us
easy
in
to
that
take care
direction,
of.
Patty. I'm working on the higher ups to move us in that direction. We built that unit, we have an exterior door. We all know that it's not that scary, so
No.
if we can take 2 or 3 animals at a time or a litter at a time, and we can help them,
Yep.
that gives them the room to
And
take
it doesn't
in
spread
however
there.
many litters they can.
Right.
We know how to keep it contained. We're not overwhelmed if we have 1 litter at a time,
Yep.
Exactly.
and we have the ability to leave the building,
And now
so.
that we know that it's not going to cause long-term effects, once they're
Right.
healed, they're healed. And now that we have a medication that isn't going to affect their liver, you know, so
And we have all of the things that Doc J has mentioned, we have all of them in-house, primarily because of her. So, she started us on the, yeah.
Yay.
Yeah. So she's been kind of the leader in like, you guys can do this, and it's not that hard. It's not that big
well,
of a
because
deal.
it was really scary, and it's really not that bad.
Yeah.
You know, and so these are just like FAQs and stuff, not specifics about how much to dose, but just things to remember. And we'll put it in the file, computer, whatever.
I'll scan it
Yeah,
and put it in
scan it,
Dropbox.
Yeah.
I'll have just one just for me to put in the
Love it.
Cat,
We only got one.
Can or cannot be transferred to dogs.
Oh, it's the same thing.
It's the same thing.
Okay.
Cats, dogs,
Anything with hair.
yeah, basically cows, sheep. So it's also not species specific, right? So it is, and dogs get ringworm all the time, and people never worry about it with dogs. It's so funny when you have a dog with ringworm in a shelter. Everybody's like, yeah, no big deal, and they never treat it with oral.
Really?
No, never. And it always makes me laugh because with cats, everybody's like, ah, you know. Dogs, I'm like, there's a lot of hair with that dog. But yeah. So, and like I said, the sheep and goats, the 4-H, the kids get ringworm all the time when they're raising their sheep, and yeah, it's crazy. But